Welcome back to Consumer Update. Peaks of Health Metabolic Center was established to address the underlying cause of disease rather than just treat the symptoms. The thought being that when the underlying cause is discovered, the problem can be treated and corrected instead of just having a Band-Aid applied to it. Here to tell us more is Dr. Tracy Linhart, who is the Medical Director of Peaks of Health Metabolic Center. Welcome to the show.
Well, thank you. It's good to be here.
I love to hear that you don't want to put a Band-Aid on stuff, because so many clinics you go in and it's just like, they're like, let's not treat the problem.
Well, the problem is there's time constraints there.
Right.
You know, it takes a long time to treat the problem as opposed to putting that Band-Aid on.
So people just want the easy way out.
A lot of people want the easy way out. They want the magic pill.
Exactly. Isn't the way life is, but it shouldn't be, because that's not giving patients the benefit of proper care.
It really doesn't. I mean, if you get to the underlying or root cause of something and you correct the problem, then they don't have to take all these medications and all these drugs.
I love it. I love it. Because, I mean, the world is kind of going in this more of a natural path, but you guys don't just do natural treatments, you also do like general medical treatments as well.
Absolutely. We're not a holistic center, you know, we're a metabolic medical center, so I'm actually digging down into the actual root cause of a problem. I mean, this started with my own issues. I mean, I became diabetic, working in the emergency room for years, you know, drinking a lot of caffeine, eating a poor diet, and you know, by the time I finished with my endocrinologist, I was on over 100 units of insulin a day and 7 drugs. And I mean, I felt worse, I was getting heavier, I was up to a size 22, which was ridiculous. So it was learning that process and how to reverse the diabetes and get off the drugs that actually got me into this.
And I think that's key. Like I said, people are wanting that, but a lot of people don't know where to go, because the general doctor, I mean, I have issues, and the doctor immediately wants to, like you said, give you the magic pill.
Exactly.
And it's not magic, I tell you.
It really isn't. Medications most of the time block a process, and that's how they work. You know, when you actually fix the process, the person is so much better. And I think the problem is I have to spend almost an hour with a patient sometimes. You know, I don't spend 5 minutes with that patient. You have to dig deep and find out the root cause. We do testing people never even heard of, you know, to find some of these things. We'll do genetic testing, we'll do, you know, actual cellular testing to see what's going on inside their body that's causing these things and fixing those.
Really, and people are so concerned about, you know, their appliances, their cars, their discs, and they don't really pay attention to their own self. They're like, oh, I gotta go to the doctor, I gotta get it quicker, I don't have time to go to the doctor, but yet.
Exactly.
And you're saying people need to stop.
Yeah, because you can find disease long before it ever starts. I mean, we can find diabetes 10 years before it ever happens, you know, and fix it before it ever happens. You know, we can correct hypertension and blood pressure issues because we get to the underlying reason it's occurring. You know, hormonal issues. How many people, you know, because of stress are having hormone issues?
Right.
You know, stress really affects your hormones.
Yes, I know that.
Yes, we both know that.
As a working mother, we know that. But you know, this is kind of frustrating to me, because this seems so simple. Like the way you're looking at, you know, medical care is so simple and so, I want to say, like, warm and back to our roots.
Yeah, and it's a lot of things. The body's a little complicated, but it is trying to get back to simplicity. You know, if you have a bad digestive tract, is it because of the food you're eating, or is it because something got into your digestive tract? You know, most of irritable bowel syndrome is because we eat poorly. So, of course, you know, I'm going to talk to that person about their diet and what they're actually putting into their system to fuel it.
You may not want to hear it.
May not want to hear it, but, you know, of course, you know, you change your lifestyle, you can change your life.
Well, see, and I love this, because you're treating the individual, you're not treating their disease.
Yeah.
You're treating the individual.
And we set up a whole clinic here to address all of those issues. We have an in-staff nutritionalist, and she's one of the best dietitians around. You know, we have doctors and caretakers that are just amazing. You know, it's just not me, it's a whole team approach. You know, and it's really funny because we call ourselves Einstein, Columbo, and Sherlock. To kind of investigate what's going on.
Right, which is fabulous. What are some of the specific things that you treat?
We do a lot of things like diabetes, thyroid disease, a lot of autoimmune like Hashimoto's, Crohn's disease, a lot of the neurologics, you know, things like multiple sclerosis, Parkinson's disease.
Really?
Because we're finding that these are linked to actual underlying infectious diseases that went undiagnosed. And, you know, a lot of these patients are going into remission and, you know, improving. So, you know, we do a lot of diet, obviously, a lot of weight loss with our nutritionist. You know, our weight loss patients actually see a nutritionist, you know, that, you know, is just amazing. thing. And then a lot of hormones. I do a lot of hormone replacement therapy. And I mean, because menopause, perimenopause, andropause become a huge lifestyle thing.
And just taking those, and I just want to kind of go back, because taking those meds, the hormones, people go, oh, I don't want to put anything in my body, but it's your body's being depleted, correct? So you're just replacing.
Yeah, we're replacing, or
Natural.
sometimes, not always do we replace. Sometimes we find out why the person is no longer producing. I'm not going to give a 25-year-old man testosterone. He doesn't
Love
need
it.
There's a reason his
Yeah.
body's no longer producing. So find out why and correct it so he can start making it again.
I'm smiling from ear to ear because I love hearing this. I love hearing it. And I wish, more doctors and more clinics followed in your footsteps, because it's refreshing. Another thing you do too is you educate the patient, right? Don't you have different seminars
We
you do each
do.
month? Tell me a little bit about that.
We just built a whole new facility that is amazing, and we have a large facility room to do seminars and lectures. And but Dr. Betty, who is our registered dietitian, she's also a PhD in nutrition, and she does monthly seminars on nutrition. So patients who want more information about their food products and where to get them and labels. I do a monthly seminar on hormones, thyroid, or diabetes, or something that's interesting to my patients. We do a lot of we have a library in our office, so our patients can actually find reference material. We try to do a lot of research into what's going on. I teach at the medical school. I teach at 2 hospitals.
Wow.
So we're heavily into education and educating doctors about what we do too.
And that's so important, because like you said, this is a partnership in your clinic between the patient and the doctors. And so you have to educate the patients, because you can tell them all day long, you need to do this, but if they don't
Exactly.
understand why, they're not going to do it.
I know, and we give our patients websites to go to, videos to look at. And these patients are hungering for that information as to what's going on, and we like to give that information to them. I love patients who do their own research. I love patients who ask questions. A lot of doctors don't want to hear their patients' questions, and my patients are refreshed because they're like, oh, ask away, because I love that. I don't mind being questioned, because again, my patients teach me all the time.
So where can they go to answer some questions? They can come to the seminars, they can go to your website, they can make an appointment.
Absolutely. We also offer, for patients who aren't sure if we're a right fit for them, they can come in and ask for a 15 courtesy minute consult, and they can actually talk to me, bring their history, bring their lab results, and we can see if it's something we can actually work with them on. If it's something I can't treat or do, I'll tell them.
I love this. I love this. So you're doing great, great work. So thank you again
Thank
for
you.
coming on the show. Thanks again. And we'll have more right after this short break.